Hey, neurofeedback experts. Welcome to our webinar on stress and anxiety. Let's talk about stress, baby. Let's talk about you and me. Okay, enough of my singing, but I'm glad that you're here because today we're going to talk about stress and anxiety. And hopefully you know that neurofeedback is FDA regulated for stress reduction. So you will have the slides that have some pictures that go along with this presentation below. But for now, you have me. So listen up so we can get started. Okay, so stress. Stress is the number one problem that is at the root of most people's health and wellness issues these days. So how do we identify stress or anxiety on a brain map? So if you remember, when you're looking at your brain map, it is essentially giving you color differentiations based upon a bell curve, and which is a statistical measure of how far off from the norm a person's brain map is indicating that their brain is functioning compared to age-matched peers. So again, remember that if you're mapping a 46-year-old woman, what your brain map will show for her is how different her brain map is from the ideal brain functioning pattern for a 46-year-old woman. So again, on the brain maps, the colors indicate green or gray is within normal limits. That's the middle part of the bell. Then anything in the yellow, orange, red area is 1 to 3 levels too high of a speed, and the blues are 1 to 3 levels too low of a speed. On a person's brain map that struggles with stress and anxiety, there will be a lot of red and yellow. So what you want to look for is red and yellow in beta, in gamma, in high beta. You may even see it in alpha. So when we see it in beta, high beta, and gamma, what that indicates is that that person is using much too much fast processing speed. It means their brain is cranking, it's going too fast, it's not coming out of that fight or flight pattern that it needs to be able to recover and to relax, to have restorative sleep so that the brain cells, the neurons, can heal. Usually, if people's brains are cranking that fast, it's very difficult for them to get into restorative sleep. So what we need to do is decrease that beta, high beta, and gamma. If a person also has too much alpha, that can indicate underlying anxiety. And so sometimes that will show up as disassociation or just lack of self-awareness in a person who is in your office. So there are people that are clearly stressed out and you can feel that hot, high energy coming off of them. And then there's others that it's more subtle, that you think the person's pretty chill, and then you do your brain map for them, and it is off the charts in beta, high beta, and gamma. So our goal is to reduce the use of the fast processing speed so that person can feel calmer, can be at a slower processing speed for focused, relaxed thinking, not scattered, flighty, feeling like they're running in a million different directions. Okay, so what does a beta, high beta, or high gamma brain map create in a person? The way I like to talk about it is that it creates stress and anxiety, but not only does it create it, it perpetuates it. So people can actually get addicted to the feelings that they have from running so hot. And I know, guilty as charged, I run that way sometimes, not really anymore, thank God, but I have run that way in the past. And right now in my life, I can feel it that the busier I get, the busier I stay. And so what that means is when I'm really cranking, it's difficult for me to slow my brain down enough to chill. And that is the essence of having to keep our brain maps balanced. So what happens is the brain needs constant stimulation. It needs to be at this high, high, high level to feel okay. So a person will constantly run, constantly think, constantly worry, which is internalized self-stimulation. So it's a busy body or a busy mind or both. That person will generally have sleep difficulties, and we're going to talk about the REM cycle and some tips on how to help people to be able to get and stay asleep in just a minute. They'll have difficulty relaxing, so these are the people that can't sit down and watch a half-hour TV show. Guilty as charged. But I do make myself sit and read or relax. People who run hot are at risk for addictions, especially to depressants like alcohol or marijuana, because their system is running hot. They feel like they need something external to bring that energy down. So many times people will go home at the end of the night and have 3 drinks because essentially it is bringing that energy down from high beta, increasing alpha so that they can fall asleep for a few hours. That's the caveat. They usually wake up at 2:30, 3 o'clock because their sleep cycle has been disrupted. Or someone will tend to smoke marijuana too for the same reason. So we need to be very careful for addictions when we're talking about people who suffer from chronic stress or anxiety. And that's something to look out for, and it's something to present habit replacement for those people so that they can get used to drinking a cup of chamomile tea before bed instead of a bunch of cocktails. Or I tell people in the office all the time that Rome wasn't built in a day, so if they are used to having 3 glasses of wine, have 1 glass of wine and then a cup of tea, and that alone will help them at least start moving them in the right direction. Okay, so they are stuck in high gear. How to get them out of it? Well, clearly neurofeedback will help to bring them out of high gear, but anxiety and stress is one of the patterns that when we change it using neurofeedback, if the person doesn't implement lifestyle changes, they will keep pulling it back based upon what they are doing out in their life and in their lifestyle. So lifestyle changes are recommended, and most times in my book are necessary for a person's pattern to actually shift and stay shifted. One strategy that I recommend for people is mindfulness, and I use this in my life. I love this. It's the idea of mindful, which is being present in your day, actually tasting the food that you eat, actually smelling the flowers in your office, actually listening to the person that you are having a conversation with and engaging with them. It's actually being in the moment you are in, not having your mind in past moments or especially in future moments, planning, doing, going. That is mindful. The opposite of that is mindful. Your mind full of all of that other stuff. So while I use this example because this was a challenging thing for me, and you'll hear me talk about mindful field tripping or mindful chocolating. So those are things that I do with my family. Mindful field tripping is if my child has a field trip, which honestly I rarely go on because I'm not equipped to do so. But when I do it very mindfully. I stay in that field trip. As much as I don't want to be there, I stay there. So I went to a farm with my daughter fairly recently ago, and we're there, and I'm smelling the animals, I'm watching them, I'm looking at her face, I'm feeling the wind on my face, feeling the sun, really just engaging in the farm, being there. And every time I would have a thought about work or about something I needed to do, I would push that thought out. I would not allow myself to attach to it and to chew on it. I would dump it out and come back to the farm. And that is being mindful instead of being mindful. Very important strategy that you can have the people in your office use to help conquer stress and anxiety. Another thing is meditation. So if people don't engage in meditation, they need to start. And I tell people you don't have to buy yourself a meditation cushion or a meditation chair. You just have to start by sitting around doing nothing for longer and longer amounts of time. Start with 1 minute. I know it sounds so simple, but just sit on your couch for 1 minute. No phone, no book, no nothing. Just sit on your couch for 1 minute. It's very difficult for most people. Then have them move up to 2 minutes or 3 minutes and have them learn to sit there doing nothing and doing the same thing. Just being mindful, enjoying the feeling of sitting on their couch. If a thought comes, push it away. Don't latch onto it. Don't spin it. Don't keep thinking about it. Let it go. Be aware of how many thoughts you have coming and going, like a ticker across your mind. Let it tick by. Don't grab any one of those thoughts. Meditation will help you do that. Something that I recommend in my office all the time is that people purchase a MuseCalm headband. It's $249. You can get it at MuseCalm, or you can also get it at Amazon. It's totally awesome. I use mine all the time. It gives you feedback using 2 frontal sensors and 2 temporal sensors on if your brain, your mind, is active, neutral, or calm, giving real-time feedback to the person on if while they're sitting there they are spinning their wheels or if they're actually calming their mind. It's totally awesome, and I wish everybody in the whole world would buy one. I looked up the company to see if I could buy stock because I've recommended it to so many people, and it's not a publicly traded company yet, but when it is, I'll be the first in line for stock. Okay, so there is a truckload of science that supports meditation and shows the benefits for calming a busy mind and helping to reduce stress and anxiety. Okay, so routines for anxiety. People really need to get themselves into a brain healthy routine. And you know how I know this? Because I've created one for myself and I stick to it as much as humanly possible, especially when I'm being good and I'm not violating my own policies. So I get up and I go to bed at the exact same time every day. And my husband mocks me because if it's 10 o'clock, and no matter what we're doing, of course not on the weekends sometimes, but during the week, I jump up and get in bed. Most times I'm there before that. So that my circadian rhythms are on a good biological clock so that I get enough rest to feel well for the next day. We already talked about not drinking or not smoking marijuana before bed, because what that will do is artificially bring the fast brain down, never teaching it to come down by itself, and then ultimately it ends up disrupting the sleep cycle. So if you know it takes you a long time to fall asleep, if your patient takes a long time to fall asleep, they need to get into bed an hour before bedtime. It takes me 1 minute to fall asleep because I'm permanently exhausted, I think. So if it takes a long time, you need to get in there an hour before bedtime. Dim the lights so that your brain and your body starts making melatonin, the hormone that will shift you into sleep. And then you can start to increase delta and theta, decrease high beta, and start shifting towards sleep. Other routines. Make time for exercise throughout the day. Exercise has been proven to increase neurotransmitters in the brain, dopamine, serotonin, feel-good transmitters to help offset stress and anxiety. So make time every single day, even if it's just for a power walk on lunch. I know people who are the busiest people in the world who find time to do that. And you really should make more time for more exercise so that you can reap the benefits for your brain. There's new science that shows something called transient hypofrontality, meaning that your frontal lobe drops out of think mode when you are in a basically mindless, repetitive, athletic experience like running or power walking or canoeing or kayaking. So doing activities like that drops the thinking part of your brain and can really help you out in terms of creativity and cutting through the stress and anxiety. If you love to think like I do the thinking in the beginning of the day so that you're not forcing a fatigued brain to stay on all day long. The brain needs breaks. So if you take your power walk break, you actually take time to sit and eat. Eating on the run has been associated with a whole bunch of gastro difficulties that are related to stress. So one of my policies is I sit to eat. Sometimes it's at my desk, guilty as charged. Sometimes I have one foot on the floor, but I force myself to sit and try to eat my meals as slowly as possible so that I'm relaxing and enjoying them and I'm bringing my brain down. Da Vinci said that we should all sup, meaning that every night for supper we should sit and enjoy a meal, and he advocated for glasses of wine while we're relaxing so that we can have proper digestion and bring that system down. And there's merit in that, so that would be a great routine too. Okay, sleep routines. This is the last thing for today. So we said No alcohol or marijuana because this disrupts the sleep cycle. What is the sleep cycle? So just to remind you how the sleep cycle works is essentially a fast brain is slowing down through the 5 stages of the sleep cycle. So what's happening is the brain is running slower and slower and slower through stages 1, 2, 3, and in stage 4, your brain is running very, very slow, where your body is almost paralyzed. Then what happens is in stage 5, your brain starts to speed up a little bit again, dreaming occurs, and what happens there is if you have a fast brain and you're a thinker, your brain is moving more towards beta and it could catch on to a thought. So if you are a person that can fall asleep, but then your patient can't stay asleep, what they need to recognize is when they wake up in the middle of the night, they cannot catch a thought or they're doomed. They'll be up. So if they feel themselves waking up, do not get out of bed, do not check your phone, do not turn on the lights. You can do one of 2 activities. Number 1 is focus on your breath, because when you're thinking in, out, you can't think about anything else. So it gives you something to focus on. Or do a body scan and relax your body and start thinking about your toes all the way up to your head, relaxing your muscles. Again, allowing you not to be able to actually catch a thought that's born out of high beta, moving you out of the sleep cycle altogether. What you want to do is slow your brain back down again so it gets into the next stage of the sleep cycle. Okay, so that's how you can help your patients that suffer from stress and anxiety. Do their brain map, evaluate it. It presumably has high beta, and gamma that you need to reduce using neurofeedback, and then giving them those tricks will help increase your outcomes in the office because they will be making the lifestyle changes that they need to help them achieve their outcomes. Okay, go get them, neurofeedback experts.